everyone, my name is Avery Rutowski, and today I will be discussing insomnia. So insomnia is a prevalent sleep disorder that is characterized by difficulties in falling asleep, maintaining sleep, or waking up too early and being unable to return to sleep. These disturbances occur despite adequate opportunity and circumstances for sleep, leading to daytime impairments such as fatigue, mood disturbances, and impaired cognitive function. Insomnia can be classified into two main categories based on its duration and frequency. The first is acute insomnia, also known as short-term insomnia. This type lasts for a few days to weeks and is often triggered by stressful events such as significant life changes, job stress, relationship issues, or travel-related disruptions like jet lag. Acute insomnia is usually transient and resolves without the need for medical intervention. The next is chronic insomnia. This type is diagnosed when sleep difficulties occur at least 3 times per week and persist for 3 months or longer. Chronic insomnia may result from underlying medical or psychiatric conditions, lifestyle factors, or persistent stress. It often requires a multifaceted treatment approach, including behavioral therapies and, in some cases, medications. For the history of insomnia, it has been noted throughout history with early references to sleep disturbances and their causes. There was an English clergyman, Robert Burton, who described insomnia in his 1628 work called The Anatomy of Melancholy, linking it to both cause and symptom of depression. For the industrialization and modernization, the rise of industrialization brought significant changes to sleep patterns due to increased artificial lighting, clocks, and ambient noises. These factors, along with changes in diet and housing, contributed to the prevalence of insomnia. Insomnia rates in modernized countries are significantly higher than in non-industrialized regions. The medical advancements was the 19th century saw the advent of various medical treatments for insomnia, including cannabis cigarettes marked as sleep aids. The discovery of barbiturates like Vernal made a significant development in pharmaceutical treatments, although these also brought risks of overdose and dependence. Today, insomnia remains a major concern, exacerbated by modern lifestyles that include high caffeine consumption and the use of handheld devices emitting bright lights. The financial cost of insomnia is substantial, with significant impacts on productivity and healthcare. Insomnia continues to be a significant medical and social issue, with ongoing research and development aimed at understanding and mitigating its effects. The risk factors for insomnia include age, gender, lifestyle factors, medical conditions, and medications. For age, insomnia is more prevalent in older adults. As people age, changes in sleep architecture, a higher prevalence of chronic health conditions, and increased medication can contribute to sleep disturbances. For gender, women are at higher risk for developing insomnia than men. Hormonal changes during the menstrual cycle, pregnancy, and menopause can affect sleep patterns. Additionally, women are more likely to experience conditions such as anxiety and depression, which are linked to insomnia. For lifestyle factors, high levels of stress, irregular sleep schedules, lack of physical activity, and poor sleep hygiene practices such as consuming caffeine or alcohol close to bedtime can contribute to insomnia. And medical conditions such as chronic pain from arthritis or any type of condition, respiratory conditions such as asthma or sleep apnea, gastrointestinal issues such as acid reflux, and mental health disorders such as depression, anxiety, bipolar, are common contributors to insomnia. And then for medications, some medications including antidepressants, beta blockers, corticosteroids, and stimulants can interfere with sleep. For a person, the age and gender does have a part in insomnia. For age, it can affect individuals of any age, but it is more commonly reported in older adults due to physiological changes in sleep patterns and increased likelihood of medical conditions. For gender, women are more likely to experience insomnia compared to men. Hormonal fluctuations and higher prevalence of mood disorders in women contribute to this disparity. For the place, insomnia is a global issue. It is affecting people in both developed and developing countries. However, the prevalence and contributing factors may vary due to differences in healthcare access, cultural attitudes towards sleep, and socioeconomic conditions. For instance, individuals in urban areas may experience higher stress levels and longer work hours, contributing to insomnia. I've also included a map and listed out the different continents and kind of gave a brief overlook at insomnia in different areas. For the time, insomnia can occur at any time, but it is often more common during periods of heightened stress, significant life changes, or illness. Seasonal variations can also play a role, with some individuals experiencing more sleep disturbances during winter months due to reduced daylight exposure and potential mood changes. And this also has that 1 in 3 people have brief insomnia conditions, and 1 in 10 people have chronic insomnia symptoms. So there are 3 levels of prevention for insomnia. The first one is the primary prevention, and we have sleep hygiene, stress management, and a healthy lifestyle. For sleep hygiene, establishing a regular sleep schedule by going to bed and waking up at the same time every day, even on weekends. Creating a restful environment by ensuring a comfortable, dark, and quiet bedroom. Avoiding stimulating activities before bedtime, such as using electronic devices, watching television, or engaging in intense exercise. Limiting caffeine and alcohol intake, especially in the afternoon and evening, as these disturbances can disrupt sleep. For stress management, practicing relaxation techniques such as meditation, yoga, and deep breathing exercises to manage stress and promote relaxation before bedtime. Developing healthy coping mechanisms for dealing with stress and anxiety, such as journaling, talking to a friend, or engaging in hobbies. For a healthy lifestyle, regular physical activity can promote better sleep, but it's important to avoid vigorous exercise close to bedtime. Maintaining a balanced diet rich in nutrients and avoiding large meals before bedtime can also help improve sleep quality. The next is secondary prevention. So this is early detection and prompt treatment. We will have screening, behavioral therapies, and medical consultation. For the screening, identifying individuals at risk of insomnia through questionnaires and sleep assessments conducted by healthcare providers. Early recognitions of symptoms allows for timely intervention to prevent the progression to chronic insomnia. Behavioral therapies, cognitive behavioral therapy for insomnia, it's called CBTI, is an evidence-based treatment that addresses the thoughts and behaviors contributing to insomnia. CBTI involves the techniques such as stimulus control, sleep restriction, and cognitive restructuring to improve sleep patterns and reduce insomnia symptoms. And then medical consultations, seeking an early medical advice for sleep disturbances and underlying condition, addressing contributors such as chronic pain, respiratory issues, or mental health disorders can help mitigate the insomnia symptoms. And then tertiary prevention, which is reducing the impact and improving the quality of life. This is when we would move to medications, support services, and chronic condition management. For the medications, there can be prescribed sleep aids or medications for underlying conditions when necessary. Medications such as benzodiazepines and non-benzodiazepine sleep aids and melatonin receptor agonists can be used for short-term relief of insomnia symptoms. Long-term use of sleep medications should be monitored due to the potential side effects and dependency risks. Support services, providing counseling, support groups, and educational resources to help individuals manage insomnia. Support from healthcare providers, family, and peers can improve coping strategy and adhere to treatment plans. And then chronic condition management, addressing and managing chronic conditions that may contribute to insomnia. For example, treating chronic pain with appropriate pain management strategies, using continuous positive airway pressure for sleep apnea, which are those CPAPs, and then managing mental health conditions with therapy and medications. And that is all that I have. So thank you so much